The following program contains graphic surgical procedures that some audience members may find disturbing. Viewer discretion is advised.
Good evening and welcome to Health Watch. In this week's program, we're taking an in-depth look at a breakthrough medical procedure recently announced by the UK-based Hennick Medical Research Institute, where neurosurgeons have announced a virtual end to mediocrity. Evidently, a number of common people are achieving dramatic accomplishments, including breakthrough incomes and world record athletic achievements, as a result of a new surgical procedure called a bilateral auditory cell lobotomy. This non-invasive surgery apparently increases a person's daily productive time logarithmically by altering the dorsal lateral prefrontal cortex and creating performance excellence. Dr. Mark Yarnell was on the surgical team that pioneered this new technique, and he now joins us live from the operating room where he is about to perform the procedure. Dr. Yarnell, thank you for joining us. Before you start the procedure, could you just explain to us how the idea for this research actually came to be, and also explain just a little bit more about how the new technique is performed?
Well, sure, Angela. You know, up until a few years ago, we believed as an entire profession that once the baby's soft spot closed in the infant's head, that was over for brain cell alterations. We thought that the cognitive hardwiring was over and there was no neuroplasticity. Just in the last 5 years, what we've learned is the prefrontal cortex, the dorsolateral area, which is the seat of rational thought, spatial and time dimensions, can be altered all the way up to age 100. The cell lobotomy, actually the process comes in 2 steps. Step number 1 is we create an extra 3 hours to 4 hours a day for the average person who is walking around tethered to wireless feed drips of irrelevant minutia. You know them as electronic focus splitters. You know, anybody can multitask, but nobody can multifocus. As you can tell, basically what we've got here is simply an electronic focus splitter. Now, they come in all forms and all sizes, and what I'm going to do is I'm going to take this focus splitter and I'm going to clamp it very carefully in a surgical vise. This is going to happen very fast, so I want you to watch closely. I'm going to put on my protective surgery glasses with the lighting, and I'm going to get to the tools that normal neurosurgeons use. What we're going to do is perform right now a cell lobotomy. Watch closely. This happens fast. Now, as we end the procedure, we pull our snips, normally used in every surgery room. It takes strength to get that snip done. You know, it's not an easy procedure. But this procedure, once accomplished, allows us to completely neurologically re-hardwire the cognitive architecture of the dorsolateral prefrontal cortex, Ms. Roberts. And that's where people gain an extra 5 months a year and do the things they want to rise to levels they never dreamed possible, which means we will bring an end to mediocrity and average incomes in our lifetime.
Dr. Yarnell, thank you very much. That was Dr. Mark Yarnell, who joined us live from the Hennick Medical Research Institute in the UK. Please join us next week when we'll discuss the increasing use of marijuana for medicinal purposes with a live studio audience. Good night.